Welcome to ONLit's video series on data-informed systems. In this series, you will learn more about the different assessments we use to collect data and inform about students' reading proficiency and development. As well, we will consider how each of these different types of assessments fit into a comprehensive assessment system that will inform the reading health of not only individual students, but also at a school and board level. Lastly, we will look at which assessments to use with which students and how often, so that we are collecting valuable data for the students we need to while prioritizing instructional time. This is the third video in this series. In this session, we will review what is meant by MTSS, or multi-tiered system of supports. This video will focus on progress monitoring measures. We will look at what these assessments are, when to use them, and with which students, what information is provided, and how often we should collect this data. Lastly, I will highlight some considerations for implementation of progress monitoring measures. Let's begin by reviewing how these types of assessments fit into a multi-tiered system of supports. This is the graphic often used when referring to MTSS. It symbolizes the tiered delivery model of flexible additive layers of support. MTSS is a framework that organizes and aligns the multiple systems, practices, and assessment procedures within a school to create greater overall efficiency and effectiveness. It is based on the understanding that all students can learn and that educators can adjust alterable variables within the instruction, content, and environment to improve outcomes for all students. It is a proactive and prevention-based model in which data are used in an iterative manner to match and monitor the level of support students receive. Importantly, it is designed to improve the overall quality of the school in that it aims to have most students, at least 80%, meet grade level expectations with core Tier 1 instruction alone. By doing that, critical resources and supports can be sufficiently allocated for those students who need more support to reach grade level standards. It is important that we're purposeful with how we're collecting data, how we're analyzing data, and how we're using it to inform instruction. Recall that assessments that answer one set of questions don't tend to answer the other questions very well. Through this outcomes-driven model, we can develop an understanding of which assessments to use, when, and why. Our first step is to identify students at risk. This is where we identify students who will benefit from more intensified instruction to support their reading development. Screening data are used to identify a student's current level of risk relative to socially valid criteria. These are brief, general indicators of a student's mastery of certain skills. Educators will use screening data to identify students needing additional supports to meet reading goals. All students are assessed using universal screening measures. This data are also used to evaluate the health of core instruction at the school and classroom or grade levels. When we have identified students demonstrating a level of risk, we need to know what their individual needs are. What are the skills they have and which skills are needed and can be targeted with instruction? We use diagnostic assessments to identify strengths and areas of need. This data will inform the type of instruction or intervention students may require. And lastly, it is important to ensure the students are responding to that intensified instruction. We want to evaluate the plan intermittently so we know the instruction is working. We use progress monitoring data to evaluate the extent to which students are learning the taught content and are on track for meeting those learning targets. In this session, we will focus on learning more about incorporating progress monitoring assessments in the comprehensive assessment system. In this session, we will learn more about progress monitoring assessments and why they are important. We will look at the difference assessing for general outcome measures versus assessing for mastery measurement of skills. As well, we will outline which students we would want to collect progress monitoring data on, information provided with these types of assessments, and how often we should collect this data. If we come back to the outcomes-driven model and look closely at where progress monitoring assessments fit into this model, we see that they are part of a cyclical process of implementing targeted instruction or intervention, evaluating the plan for student support, and then making changes or proceeding as is with the current plan to accelerate student learning. We don't know for certain that when we plan interventions, all students receiving that support will be successful. Progress monitoring data are used to evaluate the effectiveness of the supports provided and ensure that students are on track to achieving those identified goals. This data is needed to inform decisions about individual students and to make data-driven decisions at the board level on which intervention programs are leading to successful outcomes and in which schools. As it outlines in the right to read, a program that was promising may not be having good effects across most schools, or a family of schools may be getting exceptional results with a certain intervention and could offer lessons about implementation procedures for the board or province. Intervention programming will not be a one-size-fits-all. A program may have a solid evidence and research base, but may not work for some students. We don't want students to be in a 6-week or 12-week intervention, not collect progress monitoring data, and then find out at the end of the intervention that it in fact did not work for that particular student. This is a waste of precious instructional time and resources and prolongs the time that the student is struggling with their reading development. General outcome measures are often referred to as CBMs or curriculum-based measurements. These are your universal screeners. The assessment suite through Acadience, Easy CBM, or Ames Web includes your universal screener benchmarks, as well as progress monitoring protocols for the different skills. In comparison, mastery measurements are often included in a particular program or resource. So let's look at the difference between these two types of measurements. With CBMs, or general outcome measures, the nature of the targeted intervention informs the selection of the progress monitoring tool. If the intervention is intensified phonemic awareness instruction for kindergarten students, progress monitoring would be with the phoneme segmentation fluency protocols. For students in grade 1 or 2 receiving intervention that is more comprehensive and is supporting phonemic awareness, phonics, and fluent word reading, oral reading fluency protocols would be used to provide scores that correlate with overall reading performance. Scores on these progress monitoring assessments are standardized and they are considered alongside the established benchmarks. In comparison, mastery measurements assess certain sub-skills. For example, if the instructional focus for the week has been on the digraph SH, then a short assessment is administered after instruction to determine how well students have learned this particular digraph. General outcome measures should be conducted frequently, approximately every 2 weeks for students receiving Tier 2 intervention, and once per week for students receiving Tier 3. These measures are sensitive to the smallest increments of change, so frequent administration is beneficial to track student progress. Mastery measurements are typically embedded in curricular programs or resources. As an example, UFly suggests administering the spelling test every Friday, which assesses the learning of the targeted skills that would have been taught that week, as well as those in previous lessons. Computer-based programs will often have these types of mastery measurements built in, where students complete a set of lessons, perhaps do a little test or activity, and then receive a score to move on to the next set of skills or lessons, or if the score is low, repeat those previous lessons. General outcome measures monitor student progress over time and will identify students who are not making adequate progress. Mastery measurements evaluate the level of performance on a specific skill to help ensure mastery before moving on to the next skill within an instructional unit or that sequence of instruction. Let's look at examples to highlight the difference. A group of students are receiving small group instruction targeted on the vowel consonant silent E pattern. When progress monitoring using a general outcome measure, such as an oral reading fluency from Acadience, we would use that oral reading fluency protocol because we are wanting to see how each student is applying and transferring the learning of that particular skill toward the long-term goal related to the fluent reading of text. In comparison, at the end of the week with this same group of students, a mastery measurement would be to have students do a dictation activity where you are asking them to spell words containing the targeted skill or letter pattern, so you can evaluate each student's understanding of and proficiency of that targeted skill. While mastery measurements are useful and should be a part of a comprehensive assessment system to gather evidence of student learning, it is the general outcome measures that the Right to Read is referring to when suggesting that a critical component of an MTSS system is the use of valid and reliable progress monitoring for interventions. Why is progress monitoring such an important piece of the outcomes-driven model? We need those structures in place to evaluate the effectiveness of interventions. You have specialists in your schools who are dedicated to providing instructional opportunities to students who require and have a right to this support. These interventions need to be evidence-based, and the programming should reflect the instructional needs of the students. Progress monitoring data also provides valid, reliable information about student response to instruction. For students who are demonstrating difficulties, this frequent data can inform instructional decisions and planning. If students are in these interventions year after year, the intervention is not effective. We do not want to have intervention lifers in our schools. Rather, interventions should be providing the level of support required to accelerate student learning to grade level expectations. This is why early intervention is critical. Progress monitoring data will answer questions that will inform aspects of student learning and the effectiveness of the intervention. The data will provide timely information about if that instruction is working, if the student is on track to meet the learning goal, if changes to instruction are necessary because the learning has plateaued, or if various aspects of the support require intensification. Your screening data and progress monitoring should be linked. You will have a cohesive system if you are using the progress monitoring protocols that are part of your CBM assessment suite through Acadian's, AimsWeb, or EasyCBM. This allows you to make clear, explicit goals for student learning based on those cut points or benchmarks, and you are using measures that reliably inform progress toward those goals. To be clear, using the same measures does not mean you reuse the actual protocol or passage, but rather you're using an alternate form of the same task. As an example, you have a grade 2 student receiving intervention that includes targeted phonics and multisyllabic word reading. This student was identified to receive intervention because their scores were below benchmark on an oral reading fluency screener. The interventionist will progress monitor using the oral reading fluency progress monitoring protocols included in your assessment suite to see the growth in their scores. Similarly, if you have a group of grade 1 students at the beginning of the year receiving targeted support to develop their phonemic skills, you would use the phonemic segmentation fluency progress monitoring protocols included in your assessment suite. The goal of intervention is for students to catch up. Part of the intervention planning should be identifying the target goal and the time frame for each student. That goal should be based on grade level, which emphasizes the importance of early intervention in the kindergarten, grade 1, grade 2 levels, where the acceleration of learning is more achievable than when students are older and the gap is so much bigger, and getting them to grade level will take a longer time frame. Here is an example of what a progress monitoring graph could look like. What you see here is the aim line, which represents the expected growth in order for the student to reach the goal that has been set. Each X represents a progress monitoring measure being administered. Again, these are quick, easy, and reliable, and are about 1 minute for each measure. You can see here that the first 4 points are at or below the aim line. This suggests that the instruction is not working, so changes are made to the intervention. This is represented by the vertical red line. After the change was made, the trajectory starts to look different, and we see that the student is responding to instruction and showing growth. When the progress monitoring is demonstrating a regular pattern of growth, the teacher can be confident that the current intervention is working well. These measures are sensitive to small changes, so they can be used frequently. The content or level of difficulty of the measure and the time allotted for the assessment remain constant, so student change in performance can be compared across time. Before we look at which students we should progress monitor, let's review the who and how often for the other assessments we have learned about. We'll begin with universal screeners. Universal screeners are the initial assessments. These are administered to all students 2 to 3 times per year and will identify level of risk for reading difficulty. Diagnostics are used to identify the instructional needs for students who demonstrated a level of risk on the screener. These are longer, more comprehensive assessments that look at discrete skills and content. Diagnostics will identify the skills the individual student has knowledge and mastery of, and those that require instruction. These assessments are not standardized, and they reflect a sequence of skills rather than overall reading ability. Progress monitoring assessments are essential when students are receiving targeted instruction and intervention. Both the general outcome measurements, like the CBM progress monitoring protocols included with your assessment suite, and mastery measurements should be used to inform around student progress. For students receiving Tier 2 support, progress monitoring protocols at grade level should be used approximately every 2 weeks to ensure students are progressing along the trajectory necessary to reach grade level. For students receiving Tier 3 support, it may be necessary to use progress monitoring protocols that are out of grade level if the gap in achievement is significant. Progress monitoring should be done weekly to every 2 weeks to ensure the intensity of support is conducive to accelerated reading growth. Progress monitoring would be done to monitor the development for students receiving Tier 2 and Tier 3 support. These are not assessing mastery of specific skills or completion of a level or module if you are using a program. So it would be more than pulling off student data from a computer-based program. Instead, these are similar to the screeners, so they are timed and are measuring the overall automaticity and accuracy in text reading. They can be done more frequently, and we want to use them to ensure that the intensified instruction is working and that the student is on track to reach their goal. If done frequently, we will see if the student isn't making expected progress or if they have plateaued, which would indicate that changes to instruction or intensification are necessary. We know that kindergarten through grade 2 are critical years for reading development, and with the incorporation of a comprehensive assessment system, educators and schools are better informed and more timely informed about every one of their students as readers. By creating a culture of assessment used to engage in problem solving and inform instruction, teachers are in a position to respond to the instructional needs of students early on in their reading development. Melissa Lee Farrell says, "Be mindful that no child enters kindergarten or first grade who does not want to learn to read. Lack of interest in reading is the only way that young children have of telling us their instruction does not make sense to them." When incorporating progress monitoring as part of your comprehensive assessment system, there may be confusions and questions around who to assess, when, and why. Here are some things I experienced when working with a board as we implemented these assessments. When I was working with that board on shifting away from benchmark assessments to universal screeners, the incorporation of progress monitoring as part of the comprehensive assessment system was a bit of an afterthought. The first priority was for teachers to be trained and begin administering the universal screeners. It was difficult for teachers to consider adding in progress monitoring because there was still a lack of understanding around what the actual screeners were telling them, and then what to do next and for which students it was necessary to get more information about. Secondly, mastery measurements have been used to monitor student progress, whether through using the diagnostic tools, those embedded in resources like UFly, or those embedded in computer-based programs. There is a lack of understanding about the difference between using mastery measurements for formative assessment or to monitor progress versus using a general outcome measure, like an oral reading fluency as formative assessment or to monitor that student progress. Mastery measurements are certainly important and should be part of data collected. However, these measure the mastery of the specific isolated skills, whereas general outcome measures reflect the development of the integration of reading skills. Lastly, clarification around who is responsible for progress monitoring is important and how the information is shared between stakeholders. If the student is receiving instruction by an interventionist, it would be appropriate for the interventionist to be progress monitoring. However, it is essential that the classroom teacher and the interventionist have access to the student data. They're sharing that information and they are collaborating and problem solving to ensure that the instruction in the classroom and the instruction in the intervention are aligned. This session focused on progress monitoring, used to monitor and evaluate the reading development for individual students, as well as the effectiveness of instruction and intervention. A comprehensive assessment system is more than just the implementation of universal screening measures. Each of these types of assessments will provide different information that will guide instructional decisions and support student learning. It is important that data provided from these assessments be used to evaluate the effectiveness and health of the overall system so that board and school level decisions for supports and resources are data informed. As well, schools will use this information to make data informed decisions for student supports and access to intensified instruction and interventions. Implementation of this comprehensive assessment system requires a lot of learning for educators who will be administering the assessments, interpreting the data, and making those instructional decisions. It requires a thoughtful professional learning plan and clear communication so that these assessments are viewed as informative and essential for student learning. As you move forward with the implementation of data-informed systems, however that might look in your context, consider this quote: We are used to data being used as a hammer rather than a flashlight. We administered reading assessments that gave us very little information about each child as a reader outside of where they appeared alongside an arbitrary leveled gradient. We were collecting data to submit to school boards, or ministries. We need to work on shifting the culture around reading assessment and view it in light of a flashlight. Where does this data lead us? What is it telling me about each student, and how can I use that information to proceed with them so that every student has access to their human right of learning to read proficiently?